This is KHS TV News. I'm Vivian Lee.
And I'm Sammy Nguyen, and these are the morning announcements for Wednesday, December 9th, 2020.
Happy Wednesday, career staff and students. For our first story of the day, in Oklahoma, a new medical school sits in the Cherokee Nation, training Nation members to become physicians at national clinics. Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation, COMCN, is the first tribally associated medical school in the country, and they just had their inaugural class opening this fall.
Bill John Baker, the former principal chief of Cherokee Nation, is widely credited with spurring the project as far as it has come, which even included the decision to sell the nation's private jet to help begin the new investment in the Cherokee Nation medical system. This first drew the attention of Oklahoma State University to the idea of opening a medical school on a reservation island.
After we were removed from tribal lands and there was no teachers, we invested our treasury into teachers, said Bill John Baker, according to Medscape. This is a natural progression. Just as our ancestors grew into their own teachers 150 years ago, we want to grow our own doctors.
Less than half of 1% of physicians in the country are eligible for tribal citizenship, but before growing their own doctors, Bill John Baker refurbished rural nation clinics and financed the largest tribally owned outpatient facility in the country. Hastings Hospital campus, offering optometry, audiology, physical rehab, dental, behavioral health, radiology, lab, and pharmacy services.
The Cherokee Nation General Fund paid $40 million for the 84,000 square foot facility, the construction of which, while being delayed to spring 2021 by the pandemic, is nearing completion. Like the outpatient facility, the building is striking to look at. It will marry modern medicine with traditional healing practices in both service and decor.
Being a state school, COMCN isn't beholden to train Cherokee or Chickasaw physicians. However, 22% of the inaugural school identify as Native American, whether Cherokee or otherwise. In an effort to keep them connected with their communities and their heritage, COMCN is preparing residency programs in nation clinics and volunteer programs to be able to work and study traditional healing medicine and its benefits.
For our next story, federal government officials are promising coronavirus vaccines soon, some even before Christmas, and states are gearing up to begin vaccinating Americans sometime in December.
While millions of healthcare workers and residents of nursing homes may get immunized against the virus before the end of the year, the rest of the population is going to have to wait for months. Healthy adults under the age of 65 and children may very well have to wait until late spring or even summer, depending on how many vaccines get approved, how quickly they get manufactured and distributed, and how the debate goes over allocation.
This decision is being made even before the U.S. Food and Drug Administration has authorized a vaccine. The FDA has scheduled a meeting of its vaccine advisors for December 10th to consider emergency use authorization for Pfizer and BioNTech COVID-19 vaccine, and another meeting on December 17th to discuss Moderna's vaccine.
But in the fastest scenario, the FDA could give emergency use authorization as soon as next week for Pfizer's vaccine, and the federal government's Operation Warp Speed has promised to start delivering vaccines within 24 hours after that. The same thing could happen the following week with Moderna's vaccine. Pfizer and Moderna start making vaccines even while they're still testing it, and between them plan to have 40 million doses for the U.S. market by the end of December. Each vaccine needs 2 doses given 3 to 4 weeks apart.
To give you a sense of numbers, the first week's allocation for 2 vaccines with data submitted to the FDA are approximately 6.4 million doses of Pfizer and 12.5 million doses of Moderna, Health and Human Services Secretary Alex Azar said December 3rd. We'll send half of those doses initially to ensure that the second dose requirements are available 21 and 28 days later.
If 2 or more vaccines get approved by the FDA, January might be when discussion really starts on who can get vaccinated and when. Dr. Larry Corsi of the University of Washington, who is heading up coronavirus vaccine clinical trials in the U.S., has said that if Pfizer and Moderna vaccines get authorized, they could supply 50 million more doses in January and 60 million more in February and March. That adds up to 150 million doses, enough to fully vaccinate 75 million people.
The federal government has promised that any coronavirus vaccine will be provided free of charge to the American public. That will be very unlikely to change under a Biden administration. The federal government has paid $7.76 billion upfront to 4 companies alone for their vaccines: Pfizer, Moderna, AstraZeneca, and Novavax, and tens of millions more upfront or in options to 3 other countries to guarantee they can develop coronavirus vaccines.
We've paid for the vaccines, we've paid for the shipping costs and the administration costs. Will be covered by healthcare payers, private insurance, Medicare, Medicaid, and our programs to cover COVID-19 expenses for the uninsured, as are said in December 3rd.
All these plans assume the states, which are in charge of distributing vaccines, get some money to do it. So far, Congress has not allocated any money for vaccine distribution. Senate Minority Leader Chuck Schumer, a New York Democrat, has estimated the states need $30 billion to get vaccine distribution plans into place.
For our next poll, would you rather be forced to dance every time you heard music or be forced to sing along to any song you heard?
Mr. Lewis has emailed the link and also sent it through Remind for you to fill out and be featured on the next KHS news segment.
And now for the birthdays. Yesterday we had Sanjana Hossein.
And today we have Wiener Gul and Damien T.
Have a wonderful Wednesday, everyone.